Hi, my name is Jane. I'm a dental hygienist here at the Marshall Clinic. Our goal is simply to help people achieve their goals, whatever that may be. We want to empower people to make decisions regarding their oral health. We do that by having a conversation to see how people are feeling and if they have any concerns at all. Then we gather important information through assessments of the oral cavity. I know I can't see inside my mouth, so basically we act as the eyes for people to see what's going on. Then we give patients all the information so that they can make informed decisions regarding their health and any treatment options that are available. I think what makes us unique is that we really understand that each person and each mouth is very different. We tailor each appointment to each individual. We don't just slot people into standard chunks of time, but rather provide them with as much time needed to achieve the goals for that appointment. So our care is very individualized. And we don't just tell people what we're doing, we tell them why we're doing it. The why is very important so people understand our intentions and can be active participants in their care. We always like to say that you be the expert of you and we'll be the expert of dentistry. Dental hygienists do regular and thorough assessments of the oral cavity. One of the assessments we do is called probing. Probing is a way to measure the space between the gum and the tooth. It tells us information if there's any gum disease, what type of gum disease, how far it's progressed, if there's any bone loss. It tells hygienists how far down they have to go when they're cleaning. It also provides information for patients if they have any areas they need to focus on when they're cleaning at home. And based on the information that we gather, we then tailor appropriate treatment planning for their hygiene. Another important assessment that we do is we measure gum recession. So basically we measure the gum line over time to see if any areas are receding. If areas are receding rapidly or if they're affecting the support of the tooth, then we try to find out why. It could be overbrushing, it could be clenching or grinding. Whatever the reason is, we try to find a solution and we have that conversation with the patient. As much as I value the importance of coming in to see your dental hygienist, I do feel that a patient's home care is just as or even more important. I always like to make the joke that bacteria, they don't go on vacation and they don't take days off. They're constantly multiplying. So having adequate home care is really key to the health of a person's oral cavity. So what we do is we take a look around and we check to see if a patient's missed any areas. I know I still get coached on my home care. So basically we give a patient an area of focus when they go home so they think, oh, this is an area that needs special attention. We also provide patients with tools to help them with their home care and instruction on proper use. I always say that an electric toothbrush is of no value if you're not putting it where it needs to go or using it for the time that it needs to be used for. So together we work on finding new ways to help people with their home care.